And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, WEIU FM Director. My co-host, Mr. Doug Graham.
Good to be here.
Second to last show before he graduates EIU.
Penultimate, yeah.
There you go. And our guest today making an initial appearance, Michelle Mattson from Harbor Light Hospice. Welcome, Michelle.
Thank you very much.
So we don't mess your title up. I'll ask you can give your title.
All right. I am Division Director of Education and Marketing for Harbor Light Hospice.
Okay. Now, Harbor Light Hospice, let's talk about, what it is and kind of where it serves, and we'll get into some more details about hospice and kind of what you do.
Okay. We serve 12 counties in East Central Illinois. We are in multiple states. I think we've just added our 10th state, I believe. And until about 2 years ago, we were primarily in the Chicago area, Peoria area, and then they are slowly moving downstate. So we are in 12 counties here in East Central Illinois.
Okay. And your duty is in education and marketing. What does that mean? And maybe for the layperson out there.
Sure. I do education many times for just either the patient's families, for physicians, for nurses. There's a lot of myths about hospice that still exist from the years before hospice was under a Medicare regulation. So it's changed a lot over the years. So I provide that type of education, just what is hospice. So I provide that for the families as well, but I also come in and do CEU continuing education credits for nursing homes, for the nurses that work in those places, or for the doctor's office, or for anyone in the community who's a nursing professional and needs those types of things. So a lot of contracts, I take care of the contracts with the different homes and things like that.
So could you explain how Harbor Light works to be a little know?
Not only Harbor Light, but for any hospice. There are places called hospice houses. They don't exist much here in the Midwest, usually on the east or the west coast, so that people come into a house. But more typically of any hospice, whether it's us or any other hospice, which we're blessed to have in the area, we primarily go either to private homes or we go into long-term care assisted living facilities as well as independent living facilities.
For somebody who doesn't really understand what hospice is, could you explain what hospice is for, I know a lot of it is end of life and things like that. Talk about that, because it's not, obviously this isn't the most fun topic in terms of, excitement, but I mean, as obviously everyone's going to face it, so talk about that.
There's a lot of questions about hospice, and people want to know, but they're always afraid to start that conversation, so I always get that little tug on the shoulder and say, I have a question I need to ask you. So hospice is, what I always term hospice is about when quantity of days are no longer an option, and we can discuss what those how you come about those options in a little bit. But when the quantity of your days are limited, you still that may not be an option. We're all going to have quantity of days limited at some point in time, but what we can control is the quality of those days. Many times, if we think about the end of life, we think about pain, we think about sorrow. Those things certainly are in those, but they don't always have to be the overriding part of it. Birth or death, they're part of life, and they each have their opportunity for celebration. So the overriding premise of any hospice is to provide care and comfort during the last days of life, however long or short that may be.
And it's just not for the person who's in the quantity of days, it's also for the entire family, and so it's really two-sided, correct?
It is, and equally so. We provide care and comfort not only for that patient or for that resident, but also for their family members. And we come in as a team, an interdisciplinary team. We have our team of nurses, we have CNAs, we have a chaplain. Our chaplain is an ordained minister. He's also a licensed mental health worker. We also have licensed social workers. So we come in as a team to provide emotional, spiritual, as well as physical comfort for the family as a whole. Many times, especially if the family has not anticipated that their loved one is going to be facing the end of life, they're also faced with many legal issues. They're faced with all types of paperwork that's unbelievable, and that distracts from the time that they should be able to spend with their family members. When we come in as a hospice team, we have so many members of our team that can help them deal with all of those issues so that they can have time with that loved one.
Okay.
And yeah, so understanding, going off that last point there of the various legal things, like how could you give us an example of some of those things that people may not think of? Oh, I need to deal with this at this time where there's all this stress going on.
Sure. People will have many questions about insurance. Who pays for what? Who pays for hospice? Does it come out of my pocket? How do I get hospice? Who pays for it? So those issues, their doctor may have recommended hospice for their loved one, and all of a sudden they're facing all of these medical bills, and they're thinking, how do I pay for it? So we help them with those issues. Also, if a family member is having to be suddenly admitted to a long-term care facility, they have many questions about how do I become power of attorney? How do I pay for this? Oh my goodness, we've been told we've had to get together all of this paperwork, and in the meantime, I still want to be with my mother, father, sister, or brother. So we come in and help them with all of those types of issues that they may be facing immediately that's distracting them from what should be their time with their family.
Now, since you're a third party, how does the doctor play into this? I mean, would you explain that?
Sure. Hospice can be a decision that the doctor suggests to the family when he believes that quantity of days or a cure is no longer either an option or wanted or needed for that particular person. Certainly can come from the physician. It can come from the family themselves. So either the family can request hospice services for their loved one when they think that's the time is appropriate. More often it does come from the physician or some medical provider that they have been in contact with during their illness or their just the natural end of life. So the doctor does come into play. He very often will recommend those services, especially if they're enlightened about hospice, and most of them are.
He or she, by the way.
He or
I don't want
she.
anybody mad.
I always say he, and they know I mean both.
And you just mentioned that some aren't enlightened about hospice. What is it like working with doctors who may not be willing to recommend hospice or not sure, if it is the right option? Well, how do you deal with doctors in that way in your field?
Yes, I do. Fortunately, the overriding number of physicians that I'm in contact with in this area especially are very pro-hospice. They're very well educated about hospice and are very enlightened about it. Some of the issues that they might not be aware of, or if it would prevent them from recommending hospice to one of their families, is concern about payment. That's not something that's probably taught to them in medical school. So they will have concerns. Some of the myths that I've come across from physicians who simply weren't being against it, but just out of concern for their families, they thought that perhaps they couldn't be in a nursing home and receive hospice at the same time, that there might be a conflict of payment. So those types of things, I can quickly go into the physician and just share, what is the options, and they're always very welcome. The only times that I have, and I'll run into that 2 occasions, and it's been with a very much older physician who's been in practice for many years, back when hospice was typically for cancer only. And I ran into one such physician, and he said, well, I would love to have hospice for my patient, but she doesn't have cancer. So he was unaware that hospice is now for many end-of-life illnesses.
You've talked a couple times about some myths about hospice. Are there other ones out there you want to talk about?
There's many.
All right.
I'll just touch on the ones that we run into most frequently. Most often, if you've mentioned the word hospice, almost immediately you'll get a look on someone's face like, oh my gosh, I'm going to be dead in 48 hours. So that is the biggest myth, that when hospice is called in, that you are facing the true end of your life. Death is right around the corner, and that is not true. The overriding criteria for hospice still remains for any hospice is that without further curative treatment, without further aggressive treatments, that the condition would possibly be terminal within 6 months. That's still the overriding criteria. Only God knows that. But to their best ability, if the physician or the healthcare provider has determined that that is the case, then they will offer hospice. Now, that person may very well have a condition that will be true for, but they're not lying in bed, they're not debilitated at this point, but they also have agreed they do not want to continue to have treatments that are no longer going to offer them any quality of life, or most likely going to contribute to a decline in the quality of life. So if the quantity of days are limited, why do we want to further decrease the potential for quality of days? So that is a myth, that you have to be laying in bed, you have to be near death, comatose, and you're going to be in racking pain, and these angels of mercy are there's a term out there, and I must hesitate to use it, but in the medical profession, they will know it. They think that hospice comes in and we morphine them to heaven. That's a myth, a big, big myth. Going back, having roots in the days when hospice was primarily for cancer patients facing the very end of their lives, and we did have to come in and use higher-end narcotics for that. But no, that is not true anymore at all. So we are able to provide all of the services that a hospice can provide, whether you're lying flat on your back in bed or whether you're still up riding in the golf cart.
There you go.
So because there's no hospice facility, and you're bringing staff into long-term care facilities and everything like that, what do you bring with you to enhance the comfort and the quality of life and stuff like you've been saying?
It's a good question. Our nurses come in, and they are RNs. They will come in, and of course they bring their nursing bags. Not much in the way of things for that, but we provide any of the what's called durable medical equipment. So if there's hospital beds, if there's chairs, if there's any type of medical equipment that's needed, we can provide that. And of course, just the anything that you would need for basic good nursing care. We also have CNAs that come in and help with bathing, those types of things. And that's for any hospice, not just for our hospice. So when I say hospice, I'm talking generally about all hospices in general, operate pretty much the same. So as far as equipment or things that we bring in us.
The name Harbor Light, are you familiar with where that,
Yes.
How they came up with that?
Yes. This is a privately, independently owned company. It's a corporation, and we are in many states. But it was started by a single owner who had been in the medical field for many years, worked her way up through the medical environment, and had a passion for hospice. She lived in Oregon on the coast, and she lived by a lighthouse, and hence the name Harbor Light.
There you go. Had to ask. So, now, and Michelle, I know you've been in the Charleston area for a while. What led you to this company, and kind of a change in what you were from what you did previously?
Yes, I'd owned businesses for many years, and was trying to figure out what I wanted to do when I grew up. I always have had a foot in the medical field. I've had my first life was as a nurse, actually, and have always kept my foot in the field of medicine somehow, some way. Went on to get my degrees in psychology. Was really searching for a company that I could have passion with, that I could help grow. I love to grow businesses. And this company was moving downstate from Chicago, and they were opening up this area. And we were brought together, and because they know my love of opening new businesses, opening new territories, this was a great win-win for both of us.
And so far, you really like it?
I love it.
Now this is a question that you kind of asked a little, and maybe answer, but let's say that I start hospice care, and then I decide, somewhere down the road, I want to stop it because either it's my decision or just because I'm not either unhappy with it or whatever. Can hospice be stopped?
Absolutely, and you touched on another myth. They think that if they begin hospice, that's the death sentence. They can never go off. We call that flunking hospice, and that's a wonderful thing to do when you flunk hospice. So there's a variety of reasons of why you would want to go off hospice. Absolutely, no problem.
Okay.
So what are, you say that you when the hospice goes to the facility, they bring that. What kind of things do they do? Like I remember when back the only hospice experience that I've had in my short life at this point is when my grandfather was considering hospice, and I remember we wanted it was actually a physical facility. We wanted them to go there because there they could focus on quality of life stuff. And I remember very specifically it was because he could get his favorite type of ice cream from the hospice. Is there a kind of creature comforts that's provided by hospice, and could you give us some examples of that?
Absolutely. We call that pleasure feeding. So we do. We come in and talk to the family, to the patient, to the resident, and what could enhance their quality of life, what would bring quality of life to them. We do grant a wish. So if that resident or that patient has a last wish, we do excuse me, we do have companies that we can not contract with, but who have, for lack of a better word, grants that we can access. So if they want to have a special trip, and I'll give you an example.
I was hoping you could.
Yes, one of our younger patients, late 20s, young family, and he wanted so very badly to be able to take his young son fishing, and he had a very debilitating illness and disease, so we weren't sure we could make that happen, but we moved heaven and earth to make that happen. We were able to get him up and get him to have a fishing trip with his young 2-year-old son, and he did pass away the next day, so that was just a wonderful blessing to us. Another thing, one of our more vivacious hospice patients wanted to go to a Cardinals game. And that was a little more effort there, but we did get that done. We had a company that donated a bus and that we were able to outfit, and we always have a nurse go with. And so we were able to take him to a game. He had a wonderful, wonderful outing. Another one wanted to have a last dance. She was a country and western singer for many, many years. She's still with us, actually. But this was early on. This is an example of how quality of life can be for hospice patients. You don't have to be laying in your bed at your death door. So she was up and mobile, and her wish was to have to be able to sing on stage one more time. So we had a company here or a band here in Charleston who donated their time to come in and provide the music for her. And she was able to get up on stage and she sang beautifully. And her family, some members who had not been able to hear her sing, great-grandchildren who had not been able to hear her sing, was able to do that. We brought the community together and we provided a huge party for her. So those are some of the things we can do.
That's very, those are neat stories.
Yeah.
You know, again, like we're talking about hospice here with Michelle Mattson. So we want to try to bring out some of the good stories and, you know, dispel some myths and talk about some success stories. So while we're asking you some questions, maybe you can think of a couple more success stories as we get on later in the show. Now, what about, we're here in the state of Illinois where the government changes daily, and you know, Medicaid has been in the issue too. Talk about, you know, how the state regulations and Medicaid, all that's play into being able to, you know, to afford or pay for, you know, hospice anywhere, but even specifically maybe at Harbor Light.
Well, Illinois specifically has its challenges with payment. Hospice is a Medicare, a Med-A, and a Medicaid benefit. It's already built into those packages. So it is there. That dispels the myth that it's going to cost the patient or the family money. No, it does not. The only thing that I do want to bring out, which is the biggest misunderstanding, if the patient has no other payer source besides Medicare, it will pay for everything about hospice except room and board if they are in a long-term facility. And if it's Medicaid, it pays 100%, including room and board. Most insurance companies pay as well. Having said that, Medicaid and Medicare, as we both know, are in very challenging situations in the state of Illinois. Unfortunately, they're behind almost 14, 15, and occasionally it's, in some cases, 18 months behind in payment. So it is, I have my hats off to every long-term facility administrator and owner in this state. I have seen them currently and still going to great lengths to provide care for not only hospice patients, but for their own residents in spite of the challenges. So Medicaid does provide a real challenge here in Illinois.
Okay.
So yeah, that is amazing. That that someone have to operate knowing that the funds are coming, but not coming for you.
My wife runs a daycare in Mattoon, owns a daycare in Mattoon, and yeah, you have to operate on the fact that you know that you're always going to be so many months, or in this case, even a year, behind in payment, and it's not fun. It's very tough.
No. Yeah, it's also like how does that, like, can you think of specific examples like how that affects your ability to long-term plan here in Illinois?
Well, we live on faith. As I think every long-term provider does. The home environment, not quite so much. A lot of times they will have other sources of payment, but it's a scary situation. It's high on my concerns. I don't know where Medicaid and Medicare is going, and all of the cuts that are coming down the pipeline. I think everyone from administrators, owners on down, we don't know. There is no right or answer that we can see. All we see is the cuts coming down. And I just wish the public could really embrace this and think about what this is doing to the quality of care for our elderly. It is affecting their care, and the providers are going above and beyond, and in some cases even paying out of their own pockets to make sure that patients are taken care of. So it's a scary situation for
It's one of those things in the job that you do and in the hospice area that you probably don't want to be worrying about that part, but because obviously taking care of families is number one, but it really is a scary part. It's the same thing at EIU and WEIU, that you never know what's going to happen 6 months, 12 months, 2 years down the road. So it's tough to grapple with, and I'm sure that's an inner struggle at Harbor Light if they're going to keep expanding, knowing that you don't know what changes are going to come, at least in our state and maybe even other states.
Other states don't seem to be, at least in the other states that we're in, are not facing these challenges.
Okay, what's the toughest part? And I don't want to be morbid here, but when you know the end of life is coming in quantity of days, quantity of days, as you've said it, when you have to talk to the family and let them know that the end is imminent. Take us through that part of how that happens. You talk to the family and the individual, or how does that work?
Every case is different, of course. Every family is different. We have, as I said, a wonderful team. Our chaplain is a major part of our team, and he is wonderful to talk to the families. Our social worker as well, to let them know what to expect. One of the things that we see most often now, we do not in this society see natural death. We see it on TV. We see it exacerbated on TV, as if something either very gory or it's done and over with in a second, and then it comes a commercial. There are no commercials in life. So we teach people, educate them as early as we can about what is the dying process, what can you expect, because education dispels fear. And there's so much fear around death. But all of us who have worked in death, it is not morbid. We do not feel that it is, we all feel blessed, and every one of my team members are passionate about our job. We're not depressed. It's uplifting because we can actually teach people that death is a celebration. It is a celebration in its own right. So we talk to them, we educate them about the dying process, what to expect. What are the noises that they're going to make? What are they going to look like? I mean, that sounds a little graphic, but the more people know, the more at ease they are. The most important thing we tell them is hearing is the very last sense to leave us. So even though your loved one may not have responded to you for hours or for days, they can still hear you, and it's very important to let them know you're okay, and that everything is okay. One of the things that we really educate them on is to let them go with love. Let them go with love. Especially mothers. I don't care how old those mothers are, will hang on and hang on and hang on until they sense that their children, no matter how old those children may be, are okay. So we tell them to let them know that it's okay.
There you go. Very well said. Very well said. Let's go back to the wishes. Did you think any more wishes? Because I think that was kind of a fascinating part of this whole thing. Putting you on the spot, I know. I apologize.
Yes. Well, without giving away too many, details for anyone, it's a small community, and I have to follow HIPAA laws.
I understand.
We have done things from simple as little house parties. If they're in a long-term facility, perhaps they want to have a last birthday party. They want to have a last reunion. We've had little family reunions that we've put together for people that they can actually come in and have family reunions. We can provide the food. We can provide wish-making events like CDs and audios and little books and things like that. So those are... We do so many of those small type things. The major ones are usually doing trips for the families.
One of the things that I've learned in being on this show and talking to people around the community is the value of volunteers. I mean, is the volunteers come into play at Harbor Light?
Absolutely. For every hospice, not just Harbor Light, but for every hospice, we need volunteers.
What can volunteers expect to do with Harbor Light?
Everything from just coming in and perhaps in a home environment, giving that full-time caretaker just an hour or two to have an hour or two to themselves, to be able to go to the grocery store, to the beauty shop because many of, especially in our home patients, their caregivers are 24 hours a day, 7 days a week. So it's very important for them to have some respite. And our volunteers can come in and just sit in the home and make sure someone's there. They can come in and read to family members. They can come, or to the patients who don't have family members. They can come in, those types of things, pampering types of things, social visits, all those types of things, all the way to what we call our visual sitters, especially for in our long-term facilities. If the family members are far away or if they have no family members, then it's very important for someone to be with them as they depart this life. So we have visual sitters. Hospice services are not a 24-hour-a-day, 7-day-a-week service, just one-on-one. We operate 24 hours a day, 7 days a week. We're available for that care, but we do not come in and provide one-on-one care 24 hours a day. So our volunteers are a very important part of our team.
And so what? So is it the thing where they're always needed, our volunteers, and
always, always, we need them. They do go through a short amount of training. They do have to have a background check, of course, and then our chaplain does a short-term education with them and a training. Takes a full day, and they're depending on which direction they're going to go. So he will come in and do training. He'll do a training for a group of them, and our volunteers quickly become to feel as we do. Many times they're hesitant because they think, oh, that's so morbid, I don't want to be around that. But it's not. It is not morbid, and it contributes so much to your own life, and they come away with a deeper appreciation for life.
Is it hard to get motivated to go to work in this kind of job?
Not at all.
How do you keep up, for lack of a better word?
Because we are giving so much to people that it gives back to us. We have the privilege to be with people at a very precious time in their life. And when you have that opportunity to really make a difference in someone's life, to give them something of value that's going to be with them the rest of their life, if we can make what might turn a very traumatic event or a very upsetting event, if we can make that put it in the big picture, in the context of life, that this is part of life. And if we can let them have that time and make it a time of peace and a time that they will remember, not with sadness or trauma, but with just an awareness that this was a special time. That's what we do. How could you not love to go to work?
Just about 30 seconds left or so. Any other myth you want to dispel, or maybe if somebody wants to volunteer for Harbor Light, best way to go about that?
Simply contact me. And I don't know if I can give numbers or anything. Okay. It's 217-273-4618.
Okay. Michelle Mattson, it's been a pleasure having you here today, talking about Harbor Light Hospice and all of the myths and questions that people have about hospice. I know I've learned a few things, Doug?
Certainly have.
Well, thank you for having me.
Thanks for coming in. And Doug, we'll give you the last 10 seconds here. Your last show is next Monday as you get ready to depart EIU.
Yes.
So we look forward to talking to you a little bit maybe in the last couple minutes next week, and wish you the best of luck. You've done a great job here on Issues and Attitudes.
Thank you so much. That'll be fun.
All right, everybody have a great day. This is Hit Mix 88.9 and WEIU.